Andrew Kula never saw it coming. It was a day like any other. He'd been cutting down some trees on his property and decided to head inside to get something to eat and take a shower.
Everything was fine until I got out of the shower. And then I just got a little bit dizzy getting out and hit the floor like a ton of bricks. And laid there until my wife got home about a half hour later. And she came in and saw what was happening and immediately got on the phone, called 911.
The doctors at Andrews Community Hospital determined that he was having a stroke and needed special care, so they rushed him to Detroit Receiving Hospital at the Detroit Medical Center. Dr. Suzanne White is the chief medical officer for the DMC.
It's essential that people come to the hospital as early as possible. And we think of stroke just like we do with trauma and sepsis and heart attack. This is a golden hour opportunity where we can have a huge impact as long as the patient comes in right away.
Dr. Samuel Sapiti is a neurovascular surgeon who performs surgery on at least 25 stroke patients a year.
Brain typically has 130 billion neurons or nerve cells, and any minute of lack of blood supply to the brain kills those cells to an average of 1.9 to 2 million a minute, or approximately 120 million an hour. If you're fortunate that some of those brain cells are in a non-important area, you might be lucky, but you'll never know. But if you're in a critical area, that could mean a matter of life and death or life and long-term disability.
Our standard is to get the patient treated as soon as possible. And for us, that's 60 minutes or less from the time they arrive. We have internal standards around that as well. So for example, we want to make sure that we have a CAT scan completed within 25 minutes of arrival, that we have all their laboratory studies back within 45 minutes of arrival, that they have seen a stroke neurologist all along that way. So they may have the stroke neurologist at the bedside within just 10 to 15 minutes of arrival.
A new device called the Solitaire Stent had recently been approved by the FDA, and Andrew was the first patient at the DMC to benefit from it. Other devices either vacuum the clot out of the blood vessel or grab it and pull, which can leave pieces of the clot behind.
It's a very newer innovation in which it's essentially like a stent, like a rolled up chain link fence, which is compressed into a small catheter or a tube. And your intention of this procedure is you introduce this device through the catheter at the site of the clot, and you let the stent expand. And in the process of an expansion of the stent, just like a cheese grate, it integrates within the clot and supports the clot. And after a period of 5 minutes, by integration of the clot within the stent, you withdraw the stent. The other benefit of this device is, one, you're having a better grip on the clot to extract it, and number two, the moment the stent is deployed, there is a channel of blood flow that's available. Look at the tip of the catheter. Yes. So that's how we go. We deflect it to go where we need to go.
Using a combination of the Solitaire Stent and suction to ensure no pieces of the clot are left behind, Dr. Sapiti and his team can restore blood flow within 5 to 15 minutes of starting the procedure, compared to 30 minutes to 3 hours using other devices and techniques. This is a remarkable accomplishment, especially when every minute of blocked blood flow can mean the difference between life and death. DMC patient Christine Peak knows this firsthand.
I was working and I started getting kind of dizzy for a minute. So I went back and sat on the couch and I keeled over.
Fortunately for Christine, her husband got her to Harper Hospital right away, where she was treated by Dr. Sandra Narayanan.
If you have a large artery in the brain that is blocked, such as what happened with this patient, the chances of a good outcome are very low. And so in her case, she received timely administration of a clot-busting medication through her IV, as well as very rapid opening of the blocked artery on the left side of the brain, restoring the majority of blood flow. She's continuing to improve on a daily and weekly basis, and patients like her will continue experiencing improvement for likely over a year after the stroke.
Andrew Kula's outcome was also good. And a few weeks after his stroke, he had a follow-up appointment with Dr. Sapiti.
Well, this is what it looks like in the end. I'll go to the last image. It's completely gone here. There is no white stuff anymore. The clot is completely gone. As you can appreciate, everything is filling at the same time now.
Oh, he's the angel of this place. The man who made the decision at the right time and the right place. And that's why I'm here today talking to you guys.
Strokes are a leading cause of death in the United States and one of the most common causes of disability. In order to prevent having a stroke, it is critical that people understand the risk factors and symptoms. The majority of strokes happen in people who smoke, have diabetes, uncontrolled high blood pressure, or heart disease. When it comes to symptoms, sometimes there are none. But if you experience slurring of speech, difficulty speaking or understanding, loss of vision in one or both eyes, weakness or numbness on one side of the face or in one arm or leg, this could be a sign of a stroke.
The majority of strokes are not painful. They don't involve headache. And so that's different in heart attack patients, where the majority of heart attack patients do experience crushing chest pain, and it's easier for those people to convince themselves to come to the emergency room. And so we'd like to see a more timely response with stroke patients, because we can only help them once we're aware of those stroke symptoms.
To learn more about strokes or to schedule an appointment with Dr. Narayanan or Dr. Sapiti, log on to dmc.org or call 888-DMC-2500. I'm Emery King.